Hello guys, in this video I would like to share with you a presentation about choosing the dental material according to the indication. And before that, for those who don't know me, I would like to introduce myself. My name is Rekar Ismail. I am board certified prosthodontist and also dental ceramist. So all the cases that you will see in this presentation are done in the clinical part and also the laboratory part. So let's start. So according to the a kind of classification. So let's start. In this presentation, I did a very simple classification for choosing the material according to the aesthetic and according to the strength. So first, let's start with when we have a case and there is a highly aesthetic demand and we need to do a very highly aesthetic restoration. In this case, the first choice is the fully layered feldspathic restoration, either on the refractory dye material or on the platinum foil. So for this, you need a very highly skilled dental technician who knows how to use this material and understand the technique very well. So as you can see here, we have a case which is a very minimally preparation, or we can say a pre-place situation, which is we did a partial veneers for this case without any kind of preparation. In this case, the best choice to choose is the fully layered feldspathic restoration. And another indication for the feldspathic restoration, when we have a case with a very minimal preparation and the patient is asked for a very highly aesthetic restoration that can blend with the natural tooth. In this situation also, we can choose the feldspathic restorations, especially when the patient request is for a very naturally translucent and with a patient with a very highly textured restoration. So as you can see here, for this case, we did a fully layered only for anterior restoration with the feldspathic veneer restoration. We can say another indication when the patient is asked for invisible restoration. As I told you, feldspathic is very naturally can blend with the natural tooth. So in this case, we can choose also the feldspathic. As you can see in this case, in this situation, this is very challenging, especially for the old crowns. Of course, we can use the feldspathic despite that it's not very strong material, but we can use feldspathic for the crown also, especially when we are choosing the case that there is no overloaded tooth. So we can choose the feldspathic restoration, of course, for the crowns also. You can see here for this case, we removed the crowns and later we change it to the feldspathic restoration. You can see here the final result. You can see that they are very natural looking restorations because it is feldspathic restoration. But we should bear in mind these are not a very strong material, okay? And they are the best material that more mimic to the enamel of the tooth. We can say that the strength is almost like the enamel of the tooth. And we know that the enamel is also not very strong if we are separating from the dentin. So it is the same idea. When we are making a replacement for the enamel and we don't want to make a very big change in the color, because for each degree of change, like from A2 to A1, you need at least a 0.2 millimeter reduction from the tooth structure. So when the patient is asking for a big change in the color, it is not recommended to use the feldspathic. It is very challenging. Maybe you need to do a crown, then use a feldspathic restoration to mask the color and to change a color. So the second option, when we have a high aesthetic and some kind of strength demand from the patient or from the case. So at that moment, at that case, we can use the layered lithium disilicate, or which is very common, we say that IMAX veneer or IMAX crown. Because in this situation, there is a combination of the strength and the combination of the beauty, let's say, because we have lithium disilicate as a core material, which is very strong. We can say it is 4 times stronger than the feldspathic, and we are layering with the feldspathic ceramic. So there is a combination of the strength and the beauty. We should bear in mind that the denser the material, the stronger the material, but it is less translucent. So we started from the most translucent material, which is the feldspathic, and we will go toward the materials which is less transparent and more dense and more stronger. So of course we have to put in our mind that choosing the material should be according to the indication, not according to the price from the patient. The patient is not paying, or we can say that sometimes the laboratory say that let's say that the IMAX is cheaper or the feldspathic is more expensive. So we have to choose the material. Of course, we have to count the cost or the fee from the laboratory, but we should put in our mind that choosing the material, it should be according to the indication. So in which situation we are using the lithium disilicate or layered lithium disilicate? For example, in this situation, we have a case, of course, it was previously, the patient had a bruxism. There is too much wear down of the tooth. And of course, if the patient is the bruxism, it is not indicated to do any kind of veneer restorations. It's very challenging. So either you can do the veneers, but later you should consider this and using like a night guard or something like this to prevent the fracture of the restoration. In this case, you can see the patient after some years say that I don't have any kind of bruxism. So then we choose the layered lithium disilicate. You can see there is natural beauty and also more strength in the palatal size to prevent a fracture of the restoration. Or sometimes we have a patient requesting to change a big change in the color. Like the patient is A2 and asked to make like BL1, bleach shade. So in this case, it will be very difficult to make it with the feldspathic. Either you have to do a crown or too much reduction and you will reach the dentin, of course. So sometimes it is not very beautiful, but the masking capacity of the lithium disilicate is much higher than the feldspathic. So in this case, we can choose the layered lithium disilicate restorations. And as you can see here, we have a beauty of the feldspathic ceramic over the core of the lithium disilicate core. And in this case, we did a facial cutback, which is mean the full length is the lithium disilicate, but we only layered on the facial surface of the veneers to make some kind of depth and translucency. Another situation, sometimes we have very big complex cases. As you can see from this case, very challenging. We did a full mouth rehabilitation for this patient. And in this case, for the beauty, in this case, we used facial layered lithium disilicate restorations. And of course, we will come to this. And the other teeth is only monolithic, fully stained lithium disilicate restorations. So also in this case, we used this material for, this is the follow-up after 1 year. You can see still without any professional maintenance. The patient after insertion is gone. After just 1 year came back to me and I was surprised with the result. Fortunately, there is no any breakage and still the occlusion is very good. This is a very strong material, especially for the posterior teeth. I recommend to use the monolithic or facially layered lithium disilicate restorations. The third option, when the high strength, I say high strength and then the aesthetic are needed, is the layered zirconia. We come to material which is much more denser than the lithium disilicate, which is the zirconium. And for this material, it is, we can say, is the ideal material for the implant cases, especially when you need a custom abutment, and ideal for gingival area, because zirconia, which is very, if you are just doing the high polished zirconia, it is very bad compatible material. And even if it is not recommended to never again remove it, because there will be some kind of connection between the soft tissue and the abutment. So when there is an aesthetic need and biological need, let's say like this, I always use the layered one-piece zirconium oxide restoration. As you can see, for this case, we have one crown and we have one implant here. So I did with this design to make a very nice emergence profile. Of course, for this case, we did a soft tissue surgery, a very nice emergence profile, and then we designed the hybrid abutment and then only layering of the facially with the proximal area with the feldspathic ceramic to mimic the natural tooth. This is very nice way to make aesthetic and still strong restoration. And also sometimes we have a case when there is a very complex case and there is aesthetic demand, and of course there is a strength demand from the case. As you can see here, we have to replace these bridges, and this is part of the more complex case, which is for making a strong bridges. It's always recommended to use the zirconium oxide. Even if the patient asks me, doctor, I'm giving you $1 million, I cannot do it. It is very challenging. You cannot use feldspathic for the bridge, right? We cannot use it. And even sometime in the posterior region, it is not recommended to use lithium disilicate because it is much weaker than the zirconium oxide. So it is better to use for bridge restorations in the posterior region, especially use the zirconium oxide. And if you need the aesthetic, it should be with the facial layered or sometimes even the occlusal layering. But I recommend personally just do the facial layering because it is much more easier to control the contacts on the by the designer. If there is a good scan for the prepared tooth and good bite, then I prefer to do only facially layered zirconium oxide bridges. As you can see in this case, we did the bridges with the facial layered zirconium oxide. Now we come to another type of restoration, which is monolithic, or we can say full contour restoration or full anatomical restorations. These names are all the same. The idea behind this is that we are using only one material for the restoration. There is no core and there is no, like we have IMAX and there is a layering with the feldspathic ceramic. So what mean by this? This means if you are just thinking about it, this means that the material is stronger. But because we are not doing a layering with the ceramic, this is mean maybe it is not, if there is not very high skilled technician to make a very good staining or glazing, maybe they are not very natural looking restorations. What I am, for which cases I am using this material, especially when we have, like in this case, the lower veneers, very minimally prepared and there is no space to do a layering, so it will be very difficult. And especially when the patient asks to make a change of the color, of course, the patient asks to do the veneers for the lower fours, but still in the process. This patient, when it is before 1 year, I finished this case, but the patient is not came back to do veneers for the lower fours. But you can see here we did only lithium disilicate restorations, which is much more beautiful than the zirconia in the monolithic restorations. And we just did a very micro staining to give some kind of illusion, to give some depth to the restorations. So these are a monolithic lithium disilicate restorations. Of course, if there's a space making a facial ceramic layering, it will be much more beautiful. But we should put in our mind sometime we should consider that the strength and the balance between the strength and the beautiful restoration, especially in these cases, maybe there is a risk for the fracture. The second indication for the, let's say, the monolithic lithium disilicate only doing the staining is in cases when there is a breach, especially in the aesthetic zone. When there is a patient with the missing lateral incisors, we can use lithium disilicate to make a breach because we know that there is not too much of force on the lateral incisors and it is the space is very small, so we can use the lithium disilicate to make a breach here. Okay, this is part of the big case. We will do another demonstration or another presentation for this case, but this is one of the cases that I did a breach with the lithium disilicate because I need aesthetic in the aesthetic zone. And at the same time, I need strength. So as I see in this case, we don't need a very high strong material. So I used the lithium disilicate monolithic restoration. So this is the full contour monolithic restoration. And sometimes in these cases, we have only good abutments and only one pontic in the anterior region. So maybe sometimes it's difficult. You can do it with the zirconium oxide, but in this situation, what I did, I just did a very minimum kind of layering. Mostly it is a lithium disilicate bridge. And also we have 1 unit of veneer here. So this is one of the case that's old age patient and a very short span. There is not heavy force on it, so still I can use the monolithic lithium disilicate in this case. Another indication for the monolithic lithium disilicate is for the posterior restoration. You have a case full mouth rehabilitation. You want to do overlay restoration for the posteriors, so it's a very good choice to use the monolithic lithium disilicate, or sometimes you can use also composite as let's say semi-permanent restoration as overlay. So when you have even one overlay restoration, only restoration, it is better to use only with the lithium disilicate. I have some experience with the fully layering feldspathic restoration, but after some years there are some cracks and there's some chipping, so I want to use a stronger material. I know it is stronger than the enamel of the tooth, but it is the best option for the posterior overlay restorations. Now let us come to the monolithic zirconia. When we say monolithic zirconia, it is a very strong material, but we should consider that it is not a very beautiful material, especially if you are not using the multi-layer or multi-translucency, multi-layer zirconia blocks, then it will be very challenging to match the color with the natural tooth. Even if you are doing a full mouth rehabilitation, it will be very difficult. So if you are using monolithic zirconia, it is better to use a high transparent, let's say like 50% transparency in the incisal area or more, so you can use it as a monolithic restoration for anterior region. But if you have the case with the I don't have many cases like this, so I didn't put in posterior restoration. But if you have a case like for the posterior region and you need a high strength, especially when there is one bridge here previously done with the monolithic restoration, it's better to do your bridge with the same material because it's a very strong material. And if it is used against weaker material or like a natural tooth, if there is some kind of interferences or there is no occlusal harmony, it will, of course, it will stay for a long time, but your tooth, the patient's tooth will go. So we should be very careful when you are using the monolithic zirconium oxide restorations. We should consider that there should be a very harmonious function and there should be no any interference because zirconia is very, very strong material. So it may lead to the fracture for the natural tooth. One of the indication mostly that we are using monolithic restorations when there's also sometimes economical problem because it is much cheaper than the other options because there is not need too much of talented work. You just need a good designer to make a design mill of the zirconium oxide, then just doing the staining and glazing. Especially in full mouth rehabilitation like over implants, it is very good option to use monolithic zirconia or only facially cut back zirconia. And finally, we come to the material which is very weak. It is the PMMA restorations, which is I'm using a lot as a provisional restoration. Either we are doing the milling or printed monocolor, as you can see in this case, to use as a provisional restoration, or sometime we need an aesthetic provisional restoration by composite layering. As you can see here, we did a composite layering just to make for a longer time. We have to use this provisional restoration, so there's an aesthetic demand. So in this case, we use PMMI and layered with the composite, so we get a more natural restoration, because this case is part of a bigger case, which is full mouth rehabilitation patient. So we have to use for a longer time, so we should use aesthetic provisional restoration. And now I came to the end. I hope you enjoyed this presentation. And here's my contact information. And of course, we have a Telegram channel. You can join and subscribe to our channel, and also subscribe to don't forget to subscribe our YouTube channel, because I plan to make on weekly basis to make a presentation, case presentation, and more information on the way. So I hope you enjoyed. Thank you so much. Bye-bye.